U.S. government did a survey a number of years ago about why people call in veterinarians to look at their horses. Traumatic instance, colic, laminitis, and number four was eye problems. We are a very visual species, and we put that fear of losing sight onto our animals that we live with. And we'll talk a little bit about the vision of the horse. Here's just a little, the anatomy is terrible, but I'm going to make it real simple for you. We're going to talk about the cornea in the horse. The eyelids are there. They have a big upper eyelid and a lower eyelid, and horses actually have three eyelids compared to us. But the cornea is really critical because it's one of the most sensitive tissues in the body. It also is very thin. It's a millimeter thick. 1 millimeter thick in a horse, but it's really strong. But the eye diseases that attack the horse cornea are extremely powerful. So corneal disease in horses is a serious issue, and I'll show you how to recognize it here shortly. So cornea, then no blood vessels in the cornea, but a lot of nerves. When you move inside the eye, and there's a chamber there that's filled with fluid. Then there's the iris. I'll show you pictures of the iris. When you talk about eye color, we're talking about the color of the iris. Behind the iris is the lens, and it's transparent, and it doesn't have any blood vessels in it either. And then there's this large area called the vitreous, which until about 2 or 3 years ago, I never worried about the vitreous of horses. It's 99% water. It doesn't have any blood vessels in it either. It's transparent. And so in the next 5 minutes, I'm going to explain to you how the vitreous of the horse is tremendously important. And nobody else knows this, except a few people more and more are spreading the word. Then the retina is in the back. The retina is what changes the light energy into electrical energy and then sends it through the optic nerve back to the brain. The eyeball doesn't see anything. It's a photoreceptor, but it's really important, isn't it? It's very large in the horse. It's aimed a little bit laterally. But this is a diagram. People love diagrams, but this is what the eyeball looks like. Here's the cornea again. Here's the iris, gives the eye color. Here's the lens. Here's the vitreous, and then the retina's in the back. This is the eye of the horse. Just so you know, the lens of humans is about 0.25 mils, 0.25 cc's in volume. The horse is 3.0. The eyeball of the horse is huge. And it's real obvious when things go bad. There's the cornea, there's the iris, there's the lens, and the retina, and the vitreous is in between the lens and the retina. Anyway, the optic nerve takes the information from the eye back to the brain. The visual cortex of the horse is right back where their bridle sits, behind their ears. That's what they see with. If a horse has a head injury to the back of the head, sometimes they lose all their sight immediately. Until recently, there was no treatment for it. There is a treatment now. Anyway, everybody, what does a horse see?